transmission characteristics suggested that early that a natural herd immunity strategy is unlikely to be feasible, and countries needed to respond forcefully to underlying dynamics of the pandemic. And so this paper's goal was at that time in February, March, to address some of these dynamic questions that help guide decision makers towards longer term, high leverage strategies. And to illustrate this need, early analysis shows that France was really only able to test the severe high-end cases, and therefore they only captured, a small fraction of the cases, leading to less effectiveness to suppress social context of infected cases, leading you in turn to get further behind with your testing capacity. So that's
calibration. Now, it is not enough to just show that fit to the data. What helps us build confidence in the results are a few additional tests. First is some out-of-sample predictions that estimate the models up to the data up to August 10th and then predict until November 1st. They show reasonable overall fit for the longer term projections, but also with several significant deviations you can see through that. But herd immunity is not yet close for the vast majority of countries. In fact, the time it takes to get to herd immunity are in the hundreds to thousands of days for most countries based on the current rates. So herd immunity is not even a viable pathway to think about. An interesting question that has been kind of in everybody's mind is how much of a trade-off do we have between economic costs and the public health costs of COVID? And a good proxy for economic costs is how much you reduce your contacts. So if you map the relationship between the reproduction number, which is essentially a proxy for how much interactions there are and infectious interactions there are, against daily deaths per million of the population, you look at the data, the surprising result is that there is no trade-off between the two. That is, essentially every country goes to reproduction number of around 1. Why? Because if it is above 1, the epidemic continues to grow exponentially. This means huge costs, huge death tolls around us, and that forces people to bring down their contacts. And if it goes below 1, death rates go down and people stop to care. So we have all of this model available for anybody interested. On an online simulator, we have added a vaccination sector to the model that allows you to change and see how changes in responsiveness and vaccination can impact the forward-looking trajectory of the epidemic, as well as the backward. You can see the quality of the fit with data for different countries.
I think for any of you who doubted that system dynamics can be very evidence-based, all the presentations today should disabuse you of that idea. We all use data, and it's very important that we understand what's going on mechanically and that we also check our models against data. First of all is that, comparing, looking at the other models that were available from Princeton, from Harvard, from Yale, many of them lack endogenous social behavior, and so they can reliably project only about 1 month. And the modelers say, well, you can't possibly project past 1 month. Well, in system dynamics, we believe you can do better than that. That it is possible to find some rules of behavior that people follow, even when they're presented with newspaper articles that tell them how bad it is. They will still do these things because of social structures, because of norms and pressures that we can try. Cumulative COVID fatalities with January of 2020 through January of 2022. Here is January of this is where we are right now. And you see these 4 different scenarios resulting in different amounts of death. So the very best one is the blue line, where we have the best effectiveness. That's a cumulative dead by January 2022 of 585,000, all the way to the worst one, where you have unsafe behavior, lower adoption, less effectiveness.
Interestingly, when I added all policies together, I got way better results. And that's one of the things that, we who work in complex systems, we kind of understand this, because there are tipping points in these systems, and when you add 4 policies, you get more outcomes than effect of each of those, sum of effect of each of those. I want to reflect on what is going on in the situation of COVID-19. I would say that this problem has been so complex that needed including communities, needed including data, and it needed having models that address behavioral challenges that we see and they affect the transmission of the disease. Thank you.
For that, you don't necessarily have to have confidence intervals. You don't necessarily have to have operational details. So useful, I think, is context dependent.
In the general case, I think the long-term trajectory of these epidemic models usually fail to be easy to predict because the behavioral responses that change the infectivity and transmission rates are not fully predictable. Now, the models that do have endogenous behavioral responses do a better job, and I think that's what we see across all of the models that we saw today that allow you to predict, project for a few months ahead with reasonable success. But
the point that NJ is very important, and that's about we want to fix the society. So if our model is projecting something bad, so if my model projects something bad that's happening in universities, if I've done a good job, actually I should make the society move in a direction that my prediction becomes wrong, right? So I should have a good impact, so we move in the correct direction. That doesn't mean that my model was bad, but I actually did a good impact on the society to move it in the correct direction.